So I was a typical third-year medical resident. Every rotation I did, I decided that was the kind of doctor I wanted to be. So in pediatrics, wanted to be a pediatrician, and then after OB, I wanted to be an OB. But things changed. The first rotation of my fourth year, I did a rural family rotation in rural Indiana in a community that had a large population of conservative Mennonites, and my preceptor was someone that I had known from church activities. So we did all sorts of fun things. We delivered babies, we went to funerals, we saw patients in the office. And then on a Sunday afternoon, we decided to take a walk. So we walked down the rural country road, chatting, looking at the blue sky. As we came up over a hill towards us were 4 kids on bicycles and 1 adult male in a recombinant bicycle. The girls were dressed in pastel dresses with no shoes. The boys had on dark pants that were rolled up above the ankles with white shirts. The dad was sitting in his bicycle wearing flip-flops. And as they got closer, the dad yelled, "Dr. Waggy, I'm so glad we saw you." Dr. Waggy will now be referred to as Norm because I was told never to call him Dr. Waggy again. And so he was like, "Oh my goodness, it's so good to see you all." They said, "We're so glad we found you. My dad had to go to the emergency room this week, and he needs to talk to you about his diagnosis." So I looked at Norm. This was Sunday afternoon, mind you, and he said, "Sure, we'll be there in a minute." So the bikes turned around, they all rode back down the road. We continued on our walk and eventually came to a farmhouse. We could see behind the farmhouse, under the trees, were some people standing, so we decided that was the direction we should go. And we ended up behind the house, and lo and behold, the whole family was there. There was the matriarch and patriarch of the family who were standing, their children and all their spouses, and then all the grandkids were like running around, sitting on the grass, having fun. We were ushered to the seat of honor, which was the picnic table, where we sat. And then we heard the story that the grandfather of the family had had severe headaches, went to the emergency room, had an MRI, got a diagnosis of a brain tumor. And so the question for us was, could the grandfather and his wife get on a bus and take a bus trip from Indiana to Colorado the next week? Was that a safe thing to do? And so Norm looked quizzical and said, "Well, I don't know much about what's going on because I haven't seen the report yet." And they said, "Oh, don't worry, we have the scan here." So, not in today's world where you would pull it up on the computer, but they brought a black x-ray film out of the house that had a single image from an MRI on it, which then we couldn't see because we were in the shade. So a family member said, "Oh, let me go grab the flashlight in the barn." So somebody ran to the barn, got a flashlight, brought it back, held up the flashlight. Norm held up the MRI film in front of it, and he started to give the family an anatomy lesson of what we were looking at on this MRI film. He pointed out all the parts of the brain, he pointed out the tumor, and then he talked about what they could expect in the near future from what this brain tumor could do. And he said, well, the most important thing to be concerned about would be if you have a seizure while you're out and about. So he gave them seizure precautions. He told them to take the MRI film with them on their trip because they were on the bus and didn't have to worry about it going on a plane. And he said, if you end up going to the ER, take the film with you, show the ER physician so they don't have to do any expensive imaging because conservative Mennonites don't have insurance to pay for more imaging than they need. And the family asked questions, and then we went on our way and we walked back down the road to the house and had our dinner and went about life. Back when I was sitting at that picnic table, looking at this interaction, listening to Norm, was when I decided that this was the kind of family medicine that I wanted to do. So fast forward, went to residency in family medicine, got out of residency, was working at an FQHC, a federally qualified community health center. When that time was up, I decided I was going to start my own practice. So the summer came, I had no office, I had no EHR, I had no prescription pad, and a former patient called me up and said, "Hi, Dr. Edwards, can you be my doctor?" And I was like, well, okay, I guess, sure. So She couldn't come to me, so I drove to her, and we found a place to meet that was at a park on the river, very cute. Had our visit, talked about what she needed me to do. Further conversation, made a plan. I got in the car and was driving down the road, and all of a sudden tears started streaming down my face because I realized that in that visit, we had had our conversation at a picnic table. And I was just blown away. So since then, in my own practice, I see patients in the office. I see patients in their place of work. I see patients walking around the track at the local park. And I see patients at church, because we happen to go to church together. And so I've learned that being a family physician is really about meeting my patients where they are. And sometimes that means sitting at a picnic table. Thank you.